Hi. So I chose the diagnosis of adhesive capsulitis because I had a patient in the clinic who was dealing with this diagnosis, and it had really taken effect on her mentally. I noticed she'd been coming and she just didn't seem very motivated, and she was doing everything we asked her to do, and she didn't complain, but she just seemed a little out of it, and maybe not all the way there sometimes. And there was good days and there was bad days. But we had a re-eval during, I think, my week 7, so towards the end. And I had talked to her previously, and she told me that she'd been there since August, and she's pretty much in the same spot she was in August. And we did the re-eval, and yeah, it was true. She hadn't really had much of a change, especially since her last re-eval and everything. So that's kind of what got me into, or gave me the idea to do my evidence-based project on adhesive capsulitis, because I wanted to know, is there a non-invasive way of going about treating adhesive capsulitis? Because a lot of times therapy is kind of helping with preventing more freezing of the shoulder and further loss of mobility and everything, but sometimes there isn't much that you can do about increasing it all, because I stretched the heck out of this woman, and I didn't ever really see much of a change by the end of her time there. And I think it was because she was still in that freezing stage, even though she'd been there since August or something, and she went to the doctor, and the doctor told her she was still in the freezing stage. And she was like, what in the world? I've been going through this for so long. What can I do? And the doctor ended up telling her to basically get this surgery, capsule release or something. And she came back, and she did not like to hear that, because she was kind of terrified of surgeries, and she was saying like, hey, I'll do as much therapy as it takes, but I've been here forever and I don't see it working. So yeah, that's why, long story short, that's why I chose to go down this route. And I found an article, I chose the article, The Effectiveness of Acupuncture in the Treatment of Frozen Shoulder. It's a systematic review and meta-analysis. And once I found that, I was like, oh, that's genius. Acupuncture. I just liked doing the research in this because non-invasive, it's a different strategy, nothing we've ever tried, obviously. I don't know about y'all, but I did not have acupuncture in my clinic. And so I just wish I could have told her that about it. So it was published in 2018. And it had really good results. So it started off kind of describing adhesive capsulitis, which is pain, decreased range of motion, and reduced ability to perform your activities of daily living. And it's very common in people around the age of 50, especially in women going through menopause. So they used the following to see how the patients reacted to acupuncture. So they used a visual analog scale for pain. They used constant Murley shoulder outcome score for shoulder function. And they tested active shoulder range of motion, including flexion, abduction, and external rotation throughout, to kind of see, hey, is this really working? And to see how well acupuncture affected these patients. So they included controlled retrospective studies and clinical controlled trials, either randomized or non-randomized. So the patients were purely adhesive capsulitis patients in all 3 stages, and didn't include anybody with a secondary diagnosis such as diabetes or a stroke patient. So that way that couldn't be a variable in whether or not the acupuncture actually helped. So it was purely adhesive capsulitis patients. And they had a total of 966 patients that they used, which is good, so they're not just going to their buddy Frank who has a shoulder or adhesive capsulitis and like, hey buddy, let me try this acupuncture, and it somehow works miraculously, and yay. But but the conclusion was that yes, in fact, acupuncture is a safe and effective way to reduce the symptoms of frozen shoulder. Evidence showed a drastic reduction in pain, increased mobility, and improved ability to perform their activities of daily living. They did say that abduction and external rotation were not significantly affected, so they might have had some increased mobility in that area, but nothing too notable. But improved mobility, improved ability to form ADLs, and reduction of pain sounds pretty good to me. So yeah, now I just wish that I would not have procrastinated until now to do this project, so I could have talked to her and brought this idea up to her, so that I could have given her a more non-invasive approach to something that she could do for her shoulder. So yeah, overall, the acupuncture was effective, and it had some good change in it. So yeah, try it in the future if you ever have frozen shoulder. Okay, that's it.